Hi to everyone. I am Dr. Rana Pratap Maurya from Department of Orthodontics, School of Dental Sciences, Babuba Nasidas University, Lucknow. Today's lecture topic is prenatal growth and development of craniofacial region. In previous lecture, I had discussed about the prenatal embryology of craniofacial region. Now I am going to discuss on the prenatal growth of the craniofacial region. The growth of the craniofacial region is very complex, and we must know the embryology of growth of craniofacial region, by which we know about the normal development of face and cranial regions, and also we know about the congenital malformation of craniofacial region, how these malformation occurs. So growth of the cranial, facial and oral structures, it begins around the 21st day of conception. At this stage, embryo is about 3 mm in size and head begins to take place. So these are the region of head regions, head ends and tail ends. These are the developing embryo. So although there is a progressive increase in the size of embryonic disc, this is disc which is increasing in size, but the head and tail ends of the disc, it remains close together. It does not go apart by elongation of the embryonic disc. So this results in disc to bulge upwards. Here the disc is bulging upward direction, and head and tail ends remains in same position. So as the disc enlarges further, the embryonic disc becomes folded on itself at the head and tail ends. And these are called the head and tail folds. These are head folds and this is a tail fold. At this time, the two prominent bulges develops. First is developing brain and second is pericardium in the ventral aspect of embryo. And these bulging, developing brain and pericardium, these are separated by the stomodium, which is formed by the buccopharyngeal membrane. And this buccopharyngeal membrane, it separates stomodium from the foregut. The stomodium is future opening of foregut. So soon the mesoderm, which covers the developing forebrain, it proliferates and form a downward projection, which is called a frontonasal process. That covers the upper part of stomodium. This is stomodium. A neck is formed here by the elongation of the regions between the stomodium and the pericardium. This is neck. And this is achieved partly by descent of this developing heart and mainly due to the appearance of series of mesodermal thickening in the wall of the cranial most part of foregut, which is called as pharyngeal arches or branchial arches. I had discussed it in detail in my previous lecture. So the mandibular arch, which is the first arch, it gives off a bud from its dorsal end, which is called as a maxillary process. It grow ventromedially cranial to the main part of arch, which is called as the mandibular process. This is Megli process, mandibular arch, Megli process, and mandibular process here. From here, mandibular process develops. And the ectoderm overlying the frontonasal process. This is frontonasal process. Little above the stomodium. This opening is stomodium. So a bilateral localized thickening called nasal placodes here. These are the nasal placodes. And they soon sink below the surface to form nasal pits. This is nasal pits. And then the edge of each pits are raised above the surface. This nasal pits, these are raised above the surface. The medial raised is called medial nasal process or nasomedial process. Whereas lateral is called as lateral nasal process or nasolateral process. These are lateral nasal process, medial nasal process, nasolar process, and mandibular process, which gives a mandible. These are the philtrum of upper lip developed from the medial nasal process, and the various parts which develop from these processes. The facial prominence which gives up the external part of the soft tissue of face. The lateral nasal prominence here, it gives the lateral part of the nose, or ala. The frontonasal prominence, the frontonasal process, it gives forehead and bridge of the nose. And the mesial nasal process, it gives of the central portion of upper lip and crest and tip of nose. Megli process, it gives lateral portion of upper lip and upper portion of cheek. Whereas in mandibular process, it gives the lower lip and lower portions of cheek. So the upper lip, it develops from the medial nasal process as well as Megli process. Whereas your lower lip develops from the only mandibular process. Now the development of skull. So skull, it is divided into two parts: neurocranial elements and viscerocranial elements. The neurocranial elements, which consist of brain, it is divided into two parts: the chondrocranium, called the cranial base; desmocranium, called the cranial wall. So cranial base, it develops from the cartilage. A method of bone formation is chondromembrane, and chondrocranium. And the cranial part develops from the intramembranous. So it is called desmocranium. So cranial base develops from the endochondral method of bone formation, so called as chondrocranium, and cranial wall develops from the intramembranous, called desmocranium. And visceral elements, it have facial bones, mainly maxilla and mandible. So development of skull is blend of morphogenesis and growth of three main skull entities: cranial base, cranial walls, and facial bone. So cranial wall and first calvaria. First, the mesenchyma that gives rise to cranial wall or vault of the neurocranium is first arranged as a capsular membrane around the developing brain. which is composed of two layers. In embryo, it is made up of two layers, ectomenins and endomenins. Whereas in adult, it has four layers: pia mater, echinoid mater, dura mater, and scala. So mesenchyma, which is capsular membrane, it gives off outer ectomenin, which is mesodermal origin. This ectomenin, it gives rise to cranial vault as well as cranial base. Whereas inner endomenins, which is neural crest origin, is from the arachnoid matter and pia mater. The outer ectomenins divided into two layers: superficial membrane and dura mater. The superficial membrane, it gives rise to cranial wall on cranial base. Whereas second part, dura mater, it is covering up brain, outer covering up brain. So outer ectomenins, it differentiates into inner dura mater covering the brain and outer fibrous layer, which having the osteogenic and chondrogenic properties, gives rise to skull, base of the cranium and cranial wall. And inner endomenins, it forms two leptomeningeal covering of brain, the inner pia mater and outer arachnoid mater. So the osteogenesis of ectomenins occurs as intramembranous bone formation cover the dome of brain, forming the cranial vault or cavity. So the upper or dome of brain, which form the cranial vault, is intramembranous. Whereas when the ectomenins forming floor of the brain, it chondrifies as the chondrocranium that later ossify endochondrally and form the cranial base. So ossification of the intramembranous calvarial bones develops upon the presence of brain. Means if brain is absent, then no calvarial bone develops. If brain is present, then cranial walls will develop. And several primary and secondary ossification centers, it develops in the outer layer of the ectomenins to form the individual bone. Here, these are ossification sites of bones of the skull. These are ossification sites for parietal bone, for frontal bone, for squamous bone, squamous part of occipital bone, squamous part of temporal bone, okay. Maxilla, mandible, all the various parts of the bones of the skull. So a pair of frontal bones appears from a single primary ossification center, forming in the region of key superciliary arch at the 8th week of intrauterine life. And three pairs of secondary centers appears later in the zygomatic process, nasal spine and trochlear fossa. And fusion between all these centers is complete at the 6 to 7 months of intrauterine life. And two parietal bones arises from the two primary ossification center for each bone that appear at the parietal eminence in the 8th week of intrauterine life and fuses soon. The ossification center for frontal and parietal bones, they appear at the same time. So delay ossification may result in the presence of sagittal fontanelle at the birth. These are the various fontanelles: anterior fontanelles, posterior fontanelles. This fontanelle is between the parietal bone, between the frontal bone. So squamous portion of occipital bones means the part which are above the superior nuchal line. It ossifies by intramembranous from the center appearing in the 8th week of interuterine line. Whereas the part which are below the superior nuchal line, it ossifies by endochondral methods. Next is cranial base. First, the functions of the cranial base. The cranial base, it supports and protects the brain and spinal cord. And articulation of skull with vertebral column, mandible and maxilla. And also act as a buffer zone between the brain, face and pharyngeal region. So cranial base, it develops by endochondral bone formation, whereas cranial wall develops by the intramembranous bone formation. So during 4th week, the mesenchyma derived from the paraxial mesoderm and neural crest, it condenses between the developing brain and foregut to form the ectomeningeal capsule, which I have discussed previous. The development of skull starts comparatively late after the primordia of many of other cranial structures such as brain, cranial nerves, eyes, and the blood vessels, which have already developed. So these are the primordial cartilage of the cranial base. So conversion of ectomenins when it comes into cartilage constitutes the beginning of chondrocranium that commences from the 40th day of interuterine life. There are 4 primordial cartilage for the development of cranial base. This is a paracaudal cartilage, hypophyseal cartilage, and otic cartilage, and here nasal capsule. So paracaudal cartilage means which are around the notochord. So condification centers forming around the cranial ends of the notochord. The paracaudal cartilage fuses with the scleromides arising from the occipital somites surrounding the neural tubes. This paracaudal cartilage fuses with the hypophyseal cartilage. And 2 hypophyseal cartilage form the base sphenoid. 2 pre-sphenoid cartilage form the pre-sphenoid bone. And orbitosphenoid, it forms the lesser wing of sphenoid bones, and elisphenoid form the greater wing of sphenoid bone. Otic capsules, it may form mastoid and petrous portion of the temporal bone. And nasal capsules, the cartilage of nostril and nasal septal cartilage, and it also helps in the transferring of compressive forces from the incisor regions to the sphenoid region. So chondrocranial ossification. Cartilaginous skeletal development occurs in the 3rd month of interuterine life. Ossification starts in the 4th month of interuterine life. There is 110 ossification centers appear in the embryonic human skull, and many of these centers, they fuse to produce 45 separate bones in the neonatal skulls. And in the young adult, there are 32 separate skull bones they are formed. So unossified chondrocranial remnants are the ali and septum of the nose, spheno-occipital and spheno-petrous junctions, apex of the petrous bone, and between the separate parts of the occipital bone. These are the bones formed by the endocornal ossification, ethmoid bone, lesser wing of sphenoid bone, greater wing of sphenoid bone. This is body of sphenoid bone, petrous part of sphenoid bone, and base of occipital bone. The occipital bones, it have a 7 ossification centers. It is mainly formed by the endocornal method of bone formation, except the parts which are superior to the supranuchal line, the supranuchal squamous part. It is formed by intramembranous. At the 8th week of interuterine life, it have a 2 ossification centers. Whereas infranuchal line, infranuchal squamous part, it develops by endocornal method in 10th week of interuterine life, and it has a 2 ossification center. Basilar part, it is found by the endocornal methods at the 11th week of interuterine life, having 1 ossification centers. And the condylar part of occipital bone, it is also formed by the endocornal methods at the 12th week of interuterine life. It has a 2 ossification centers. The temporal bone, it has 11 ossification centers. The squamous portions of temporal bone formed by the intramembranous methods of bone formation at the 8th week of interuterine life, having 1 ossification center. Tympanic ring formed by the intramembranous ossification center at the 12th week of interuterine life, having 4 ossification centers. By the petrous part of temporal bone, it is endocornal method of bone formation at the 20th week of interuterine life. It has a 4 ossification centers. And styloid process, they are also formed by the endocornal method of bone formation at the time of birth, which have 2 ossification centers. Sphenoid bones, it have up to 15 ossification centers, in which the greater wing of sphenoid and lateral pterygoid plate is formed by the intramembranous method of bone formation at the 8th week of interuterine life, have a 2 ossification centers, and medial pterygoid plate formed by the endocornal method of bone formation having 1 ossification centers, and pre-sphenoid and post-sphenoid formed by the endocornal method of bone formation. The pre-sphenoid formed at the 20th week of interuterine life, and post-sphenoid formed by 16th week of interuterine life. Both have a 4 ossification centers. The ethmoid bones, they have a 3 ossification center, and inferior nasal concha have only 1 ossification centers. The ethmoid bone, the entire ethmoid bone formed by the endocornal method of bone formation. It formed at the 16th week and 36th week of interuterine life. It have 1 plus 2 ossification centers. Whereas inferior nasal concha, the entire bone formed by the endocornal method of bone formation at the 20th week of interuterine life have 1 ossification center. Next, cranial base flexure angle. Angle at the hypophyseal fossa where precondylar and condyle parts meet each other. There are 4 stages. The precartilage stage, which are 150-degree angle, cartilage stage at the 8th week, which have 130-degree angle, and pre-ossification stage around 10th week, which have 115 to 120-degree angle, and 4th stage is ossification stage. The angle change from 125 to 130-degree angle. Means first the angle decreases and then angle increases. So there is uneven growth of the cranial base. Initially, anterior cranial base, it increases its length and width by 7 folds between 10th to and 14th week of interuterine life. Whereas posterior cranial base, it grows only 5 folds of interuterine. Next, facial skeleton. The face may be divided into 3/3: upper face, middle face, and lower face. Upper face is corresponds to frontonasal process embryologically. Middle face corresponds to maxillary process embryologically. Lower face corresponds to mandibular process embryologically. The parts arising from the frontonasal process: upper parts of face, nasal septum, premaxilla, filtrum, upper lip. These originate from the frontonasal process. The growth of upper face is primarily of neurocranial composition. Means it initially grows most rapidly. Whereas growth of the middle and lower third, it is slow and is fairly prolonged. So facial bones develops intramembranously from ossification center in the neural crest mesenchyma of the embryonic facial process. The maxilla forms within the maxillary prominence. So ossification of maxilla occurs slightly later than in the mandible. A primary intramembranous ossification centers appear for each maxilla in the 8th week of intrauterine life at the termination of infraorbital nerves just above the canine tooth lamina. And secondary cartilage appear at the end of 8th week of intrauterine life in the region of zygomatic and alveolar process that rapidly ossify and fuse with the primary intramembranous center. And two intramembranous, the premaxillary centers, appears entirely on each side in the 8th week of intrauterine life and rapidly fuses with the primary cartilage maxillary centers. And single ossification centers appear for each zygomatic bone and squamous portion of temporal bone in the 8th week of intrauterine palate. The palate is formed by the contribution of four elements. One is intermaxillary segment. This is from the medial nasal prominence. The intermaxillary segment from on either sides of the counterparts of the medial nasal prominence. It forms the anterior part of the palate. Maxillary prominence, palatine part of maxillary prominence, and palatine part of intermaxillary segment. So these four parts contribute in the formation of the palate. So intermaxillary segment formed by the fusion of medial nasal prominence with its contralateral counterpart. It forms the primary palate. Means it becomes the anterior 1/3 of the definitive palate. Whereas this maxillary process expands medially to give rise to the palatal process and fuses superior to the tongue. And palatine process, this palatine part of the maxillary prominence, it fuses with each other in the horizontal plane and nasal septum here in the vertical plane, forming the secondary palate. Simultaneously, developing mandible expands to increase the size of oral cavity, which allow tongue to drop out of way of growing palatal cells. The most posterior part of palate does not ossify and it forms the soft palate. Mid palatal suture, it ossifies at the age of 12 to 14 years. A cleft of palate occurs if palatal cells fail to fuse together due to tongue fails to descend as underdevelopment of the mandible. So descending of tongue is very important for the fusion of for the formation of palate. So incomplete penetration of mesoderm into palatal cells can give rise to submucous cleft palate. Next, mandible. First structure to develop in mandibular division of trigeminal nerve that precedes the mesenchymal condensation, forming the first arch. The prior presence of nerve is necessary to induce osteogenesis by the production of neurotrophic factors. If nerve is absent, then mandible will not form. So this is very important for the presence of nerve to induce the osteogenesis. The mandible develops by the intramembranous ossification and form from the ectomesenchymal condensation around the 36 to 38 of interternal line. So a single ossification center for each half of mandible here, ossification center, arises in the 6th week of interternal line in the region of this bifurcation of inferior alveolar nerve into the mental branch and incisive branch. Bone begins to develop lateral to Meckel's cartilage during the 7th week, and it continues until the posterior aspect is covered with. Here, this is the Meckel's cartilage, and this is initial site of ossification. So it develops lateral to the Meckel's cartilage. There is a marked acceleration of mandibular growth between the 8th and 12th week of interternal line, and ossification stops at a point which will later becomes mandibular lingula. And remaining part of the Meckel's cartilage, it continues on its own to form the sphenomandibular ligament and spinous pyrosis. The spinous process of sphenoid bone and sphenomandibular ligament is remnant part of Meckel's cartilage. So condylar cartilage develops initially as a separate area of condensation from the body of mandible. This is body of mandible and this is condylar cartilage. And only later it incorporates within the body of the mandible. So Meckel cartilage, it persists until as long as 24th week of interternal life before it disappears. And secondary accessory cartilage appears between the 10th and 14th week of interternal life to form the head of the condyle and part of the coronoid process and mental vertebrae. These are the accessory cartilage, secondary accessory cartilage of the mandible. Thank you.